supporting caregivers through this process and for any of our cancer patients is really important, because I think the caregivers are often the forgotten folks in this journey. We focus on the patient, but we sometimes forget about the caregiver. So I think being aware of the caregiver and the stress that they are undergoing as a caregiver for somebody that has cancer and going through the CAR T-cell journey and the impact that this has on their life. Maybe they're trying to work and manage all of this. Maybe they've got small children that they're trying to manage, and what are they going to do with the small children as their spouse undergoes the CAR T-cell journey? So I think there are lots of things that we need to, consider through all of this, and, that we need to keep the caregiver on the forefront, and, referring them to resources like, our caregiver support group or some of the community resources that are out there, like Cancer Care and Cancer Support Community and things like that, I think are really beneficial for our patients. Also, counseling. We offer counseling for our patients and our caregivers if they want to take advantage of. So I think getting them connected to those resources if they want to. Sometimes it's just really good to have an impartial person to be able to talk to who sees things from a different perspective and is not directly involved in the caregiving process or actually being a patient. The other thing is, I think getting patients connected to resources in their community are really important, because not every patient lives close to a treatment center. Many of our patients come from the community, and we always want our patients to go back into the community, but getting them connected in their community, maybe with a local support group at their local cancer center, or a counselor, a mental health counselor or a psychologist if they feel they want to talk to somebody that is local to them. And I think the compliance will definitely be better if we can provide those resources locally. And also, with the advent of the pandemic, we've been able to do a lot with online support groups and things like that. So really encouraging patients and their caregivers to take advantage of these resources, is really important. And I always encourage our patients to do that. I would say the top concerns for caregivers as our patients undergo this journey are the financial concerns. That's always a huge concern for any of our patients and their families. Like I said, this could wipe out their finances, and at the cost of a CAR T-cell infusion and hospitalization and all the care that goes along with it. People don't have that kind of money to, put out. So finances is always a concern. So getting them hooked up with our financial counselors, our financial group, our social workers is really important. Trying to optimize their insurance is another thing that we look at. Do they have they optimized their insurance? Do they have a secondary insurance? Do they have a prescription plan? If they need home care, do their plans cover home care? So I would say finances are the biggest thing. And finances, also include, like I said, the transportation, the routine costs of just everyday living, the mortgage, the electric bill, the food bill. The other thing I would say is probably the family unit, meaning that if our patients are going to be away from their family, if they have small children that they need to arrange childcare for, or somebody to watch their house while they're away, all those are huge concerns for caregivers as well as patients. And I think those are probably the two big things.